The Luxe Peel is a phenol and croton oil based aggressive skin peel for the face. You can do the whole face for sun damage, fine lines, etched lines, precancerous lesions. If you have actinic keratosis, have had basal cell before, this is a treatment for precancerous skin conditions along with the cosmetic results. It is a deep exfoliation into the reticular dermis, where you are recruiting stem cells from the hair follicles to regenerate the skin. One of the best things about this peel is the no-see, no-touch treatment for the first week. You think of, CO2 laser resurfacing where you are shedding the skin and you're doing vinegar soaks 5 times a day and watching this skin come off your face and worrying about these little open areas and things. The Luxe Peel, after the peel, we are applying a bismuth mask that protects your skin for a whole week. And all you have to do is keep this dry and your skin is healing under it. So by the time that comes off at 1 week, you are through all the difficult part for the patient of watching this all happen. So that is just incredible about this peel. So when we're doing just the eyelids, it just peel the eyelids and put the yellow bismuth on then, and you come back in a week. We take that off and the skin is all regenerated already. So you don't have to go through all that slough period. But it is an aggressive peel that gets down to the reticular dermis and truly regenerates your skin. We are seeing etched lines go away in a way that nothing else has been able to touch these lines. You'd have to do a fully ablative CO2 laser resurfacing, which is 8 months of a red face. Used to do it. Nobody can tolerate the downtime anymore. But this peel, with the full face, it is a good 3 weeks of downtime, but the results are incredible. I decided to do it because I felt my eyes were aging me. And I honestly feel like the eyes are what ages most people first. And when we talk to people, we look at the eyes first. And the crepey aging skin around the eyes from sun damage and just environmental things, this peel will just correct. And peeled skin doesn't really know how to age anymore. So the results are incredibly long lasting. I hate that term one and done, but if there's anything that we do that's one and done, this thing is incredible. It's a non-operative operated look of the eyes where you can really improve the redundancy of the upper skin and just the texture, the smoothness. It's not Barbie doll smooth where you're looking saying, what in the world, the eyes are not in harmony to the rest of the face. You will get some texture back and things, but the improvement in the aging part of the skin is phenomenal. The one changing factor there is if you do need a little bit of fat taken out and it is the puffiness that bothers you, this will not hit your expectations. I will also say I have done a couple patients that had blepharoplasties done years before, but still wanted this peel because it deals with the texture and the true skin. With surgery, you're just getting rid of extra skin and taking out some fat, which improves the shadowing and things. But if you don't have any fat and not a lot of extra skin, just the crepey texture that you feel is aging you, then this is a great option. In the face, it is all about harmony. We all know that person who put everything into their top part of their face and nothing to the bottom. The disharmony is not a goal. So if you have very sun damaged skin on, your whole face, very much the same as your eyes, you are probably not going to do yourself any favor by doing just your eyes. And, that's something that between me and Dr. O'Brien and Dr. Hayes, we would hopefully steer you in the right direction. But it is all about harmony. So typically, if you're doing just the eyelid peel, you are feeling like your eyes are aging a little more than the rest of your face, which it is thinner skin. So the fine lines become more apparent there than on your cheeks and forehead and such. Day of the peel, if you don't have an already clean face, we will wash your face, take a full round of pictures. We then go into the procedure room, put a little Pronux, the nitrous oxide all set up. First, you start with a little acetone to the eyelids and then the phenol application. The phenol makes the nerve endings all numb. It numbs the nerve endings. So as you apply it, you can almost count 11 seconds and the stinging will be gone. It's a very mild burning, but you feel it. 11 seconds, it's gone. We go to the lower eyelid, 11 seconds, upper, lower, and then go to the croton oil. Apply the croton oil very gently. We use different strengths for in different areas. Very well tolerated, occasionally needing to breathe on with the nitrous for a minute. When we finish, we put the bismuth on. It feels very good. Feels nice and cooling when you put it on. The nitrous oxide is out of your system in about 6 minutes, and we chat for a minute. Your eyelids are then very yellow. The bismuth is a yellow color. It goes on creamy. It gets kind of firm before you leave. We have you stay here till it's not crusty, but it's firm. It's like a mask. You can blink and everything. It's very comfortable. You forget you have it on. Over the course of the week, it just sort of slowly kind of flakes off a little bit. At 1 week, we apply what's called Hydrobalm. It reconstitutes the bismuth so it gets back to that creamy, soft feel. You jump in the shower using just the fat pads of your finger, kind of clean it all off. Anything that's staying, if something feels like it wants to stay, you leave it. We never pick any kind of crust off. That is the risk of this peel. Things are healing behind it, and it is spitting off that mask as you heal behind. So you want to be sure that you're not picking any of that off. It's like a scab or anything anywhere else. That will cause scarring, and that is the biggest risk with this peel, is scarring. Any time that it has happened, it has been a situation where it has been picked at and tried to get off too soon. Again, the full face croton oil peels are done under general anesthesia. Part of that is because of the phenol, and you have to apply it slow. It can, in history, has caused some heart arrhythmias. So patients really need to be on a monitor when you're doing that. A known plastic surgeon, Dr. Richard Ben-Simone, is known worldwide for chemical peeling. He is up there with Dr. Heder, who is the one that kind of played around with the Baker Gordon phenol peel and introduced more croton oil and has gotten this to a safer and a less hypopigmentation than some of the phenol peels of, I'll say, the olden days. The modern day peel, it does not have as much of a risk of that. We can do this peel in all fit skin types, 1 through 5. So it all kind of went away when lasers came out and everyone was doing lasers and it's all lasers. Well, lasers, when you get this aggressive, you really get into problems with pigmentation and scarring. And seeing those templates, we've all seen patients that have stamped on appearance of the lasers. The chemical peel, you don't have those issues, and it's so much more customizable. The percentages of these solutions come in all different strengths, and you can really customize it to a face. It's very artsy. I think that's one of the main reasons why we decided to do this. Is it's safer, more customizable, controlled than the expensive devices that come with a little more. You're handcuffed to a little more skin types and depth that you can go safely. Our most current prices are always on the website, so you could look there. I will tell you the price of this for the results that you get is incredible. It is very results driven.